Good afternoon, everybody. It's an honor to present you my 6 months progress report on heart rate variability in anxiety disorders. My name is Tamás Óvári, and I would like to change this slide. It was successful. So my name is Tamás Óvári. I'm a resident and a first-year PhD student. And with my team, we have a clear vision. We need a world where every individual has the tool to diagnose anxiety disorder in a personalized way. We have 2 ongoing projects. The first will show us the relation between HRV and the severity of anxiety, and the second will show us the best therapeutic approach in anxiety disorder. So the first project is investigating the correlation between heart rate variability and anxiety severity as measured by standardized anxiety scales. We know that anxiety is a very prevalent mental disorder affecting more than 300 million people worldwide. And we have another problem. We have a huge gap between the number of the doctors and the growing number of the patients. Currently, we use standardized scale to detect the level of anxiety, and in most cases, they are self-reported scales, so they are subjective. We need an objective, cost-effective, and time-efficient personalized method to diagnose this disease. We know that patients with anxiety disorders have different heart rate variability than the healthy individuals. So if we're monitoring that, it can be a useful method to diagnose patients with anxiety. So our aim is investigating the effectiveness and accuracy of the heart rate variability in patients with anxiety. In that case, we came up with a clinical question: how does heart rate variability correlate with anxiety severity as measured by standardized anxiety scales among different populations? We used the PFO framework, where P was the adult patient, F was the heart rate variability domain, and the outcome will be the severity of the anxiety. Our hypothesis: the patients with anxiety exhibit significantly lower heart rate variability, which corresponds to higher score on a validated anxiety scales. It's important because we need a tool for objective measurement of anxiety. In this topic, we don't find previous meta-analysis or Prospero registration. Our study, based on 2 observational and 2 case control study, which clearly show us the connection between the HRV metrics and the psychiatry scales. This is our search key, which we use. 2 domains. The first domain stands for the psychiatry scales, and the second is the HRV metrics. We screened over the 4 major databases, and we found more than 10,000 articles. After the duplicate removal, the title abstract selection, and the full text selection, we have 73 texts. And after that, we use the citation chaser, which give us nearly 3,000 new references. And after the same steps, we have 18 new articles. So regarding the first project, the topic was feasible. We performed the Prospero registration, and after the duplicate removal, title abstract selection, and full text selection phase, we are on a halfway on a data extraction. Let's jump to the second project. It's a very preliminary phase. It's comparing different therapeutic approaches for the management of anxiety disorder. As we speak, the anxiety disorder is a very prevalent mental health condition with excessive worry and fear. We have three main treatment approaches: the pharmacotherapy, the CBT, and the combined treatment. We know that the pharmacotherapy could give us some side effect or delayed relief, while the single CBT is very slow, could be expensive. So instead of that, we should use the combined treatment because of the synergetic effect. In that case, our aim to find the best therapeutic option for patients with anxiety disorder. In that case, our clinical question is which therapeutic approach is the most effective and safe in reducing the severity levels of anxiety. In that situation, we use the PICO framework, where the P was patient with anxiety disorder, I is combined treatment approaches, C1 is pharmacotherapy, C2 is CBT, and the outcome will be the anxiety severity or maybe some HRV domain. Our hypothesis: the combined treatment is more safe and effective in reducing the level of anxiety comparing the pharmacotherapy or CBT alone. It's important because we need a tailored and more effective anxiety treatment. In summary, we have two ongoing projects which help us understand, diagnose, and treat the anxiety disease. Anxiety usually leaves the patient in the darkness. So with science and compassion, we can turn them the light. I would like to close my presentation with Albus Dumbledore quotes: happiness can be found even in the darkest of times if one only remembers to turn on the light. Thank you for your attention.
Congratulations on your presentation. I would like to ask that the HRV can be a reliable marker in order to diagnose or monitor anxiety patients?
Currently, we don't use this method, but this is our aim to implement it in the clinical practice.
Thank you.
Great presentation. Sorry.
Go on.
So great presentation. Thank you. Can you also use this in arrhythmias?
Interesting question. Thank you. Anxiety usually occur at the young or middle age, while this conductive disease or arrhythmias came up at the elderly population. So they are not our population in this study.
Hello. Congratulations. I have a question about your second project, because I'm assuming you are talking about severe anxiety. And isn't that the standard of care for severe anxiety is not therapy and pharmacological intervention?
It depends on your hospital. So some hospitals use both of them, but some doctors use just the pharmacotherapy or the CBT. Yes.
Yeah, but theoretically, in the maybe some guidelines, I don't know if there exist. It's not the standard of care.
We are in a preliminary phase at the second project, so we don't check the current guidelines.
Thank you for your presentation. It's really nice to have someone from the field of psychiatry. And my question is, was there any heterogeneity in which circumstances, and how did they measure the heart rate?
Nowadays we have a lot of variable sensors, so we can measure it in a lot of ways. But we need some standardization for that study, so we are working on it.
yeah, maybe you will have some suggestions at the end.
I hope.
Thank you.
One more question, if possible. Regarding your first project, of course, this might sound not really great, but stick with me. Cannot a patient cheat in his heart rate variability test? I mean, by employing a certain state of mind. Can he cheat?
The patient can cheat on the self-reported scales, and I hope the HRV will be an objective method. So we need to test it, and we need to implement it in a practice to find the answer.
Thank you.